Hello, I'm Bill Connors from aphasiatoolbox.com. In this video, we're preparing to accompany our June 2014 newsletter, and our topic is the young person recovering from aphasia. So let's talk a little bit about the young person with aphasia. We now know that the aphasia recovery plateau myth is dead. We've buried it. The evidence is in. Now, this is especially true for young people recovering from aphasia, as they have even more potential and more powerful neuroplastic recovery ability. Also gone is the notion that stroke and aphasia only happen to older people. Our newsletter this month, Sharon Renhack, our editor, is focusing on stroke and aphasia in young people and raising the question whether there's an increase. That young person with aphasia then is going to have high ambitions, high aspirations and goals, and the idea of living with that aphasia for the rest of his or her life just clashes with that youthful spirit and visions of a rich and robust, wonderful life. So it is a brave new world in the rehabilitation of aphasia, and it has clinical implications for caregivers, speech pathologists, and the young person with aphasia. So for you, the caregiver coach, we recommend you make sure that young person with aphasia turns into a young person recovering from aphasia. That person needs to get 2 to 3 hours of daily smart practice. You can get training yourself through aphasiatoolbox.com, perhaps your local clinic or local aphasia center. We even have a 5-hour formal course at homeceuconnection.com on the Aphasia Practice Coach program. So we want to make sure we're using smart, aggressive treatment after discharge from the hospital or the rehab center. You need to make sure we're taking advantage of today's technology and, of course, the social networks like the Aphasia Recovery Connection Facebook page. For the SLP, let's make sure we make that perceptual shift to become a therapist who truly exploits neuroplasticity and who aligns their evidence-based practice with what it really is, driven by the client's goals and aspirations, who they are, and then keep that fresh with formative assessment as you're working with the client. Turn that person into an aggressive person recovering from aphasia by helping them overcome learned helplessness. Don't serve as their frontal lobes. Make sure they're getting lots of practice in, and find them help when you need to discharge them. Appreciate the generation tendencies, especially, let's say, between Generation Y and Generation Z. We'll be talking more about that in a future video. So remember that person with aphasia may have some unique characteristics, such as switching attention easily, but maybe a shorter attention span. It's been said that Generation Z might have upwards of 11% of those young people who have attention deficit disorder. So remember that these young people are going to be comfortable with telepractice, which gives us a pretty good advantage here. So for the young person with aphasia, you guys out there who have this problem, make sure you find aggressive rehabilitation sources who do not give up on you and who are truly skillful at exploiting your powerful neuroplasticity. You've got to get a lot of practice in, but it can't be busy work. It can't just be an app. It just can't be a worksheet. It's got to be a rich, robust program. And make sure you find help in finding another program when you need to leave one. Become the pilot of your own recovery. Turn yourself into a person recovering from aphasia. And make sure you're engaging your whole person. Rest, nutrition, exercise, spirituality, whatever it is that makes you who you are. Get going with that again. If you have questions about how to do that, contact us. Study and learn about what, as a good consumer, what should good therapy look like? What's the best? And remember, with telepractice, we do this all day long. You can connect with the best resources in the world from your own living room, and it's good. I want to wind up by talking, going back to 2004, when Dr. Small, in the American Speech and Hearing Association's publication, started talking about how we need to look at aphasia like we look at some other syndromes, and say, let's shoot for a cure. Let's work, especially with young people, to be more aggressive and to look at their goals. The incremental gains that we're seeing then are not enough, especially for the young person. So while they are helping, we need to make more rapid changes. We need to be aggressive. And we need to, first of all, believe that it's possible. So, for any questions, information, or if you'd like a copy of this PowerPoint, contact me at information@Aphasia Toolbox or at the phone number that's there. And feel free to contact us if you want to find out more resources in your area. We can refer you to a brain-compatible aphasia treatment program certified speech pathologist in your area, or we can help you get a coach for your practice. Good luck as you travel the pathway of aphasia recovery.